Hi, I am Dr. VVS Chandrasekharam. I am the Chief Surgeon of the Department of Pediatric Surgery and Pediatric Urology and Minimally Invasive Surgery at Ankura Hospitals for Women and Children, Hyderabad. Pediatric surgery is a very specialized branch of surgery. Pediatric surgery deals with most of the surgical problems in children from birth till 16 to 18 years of age. Most commonly, these are congenital problems associated with either the gastrointestinal tract, the liver and the biliary tract, or the chest, the lungs, and the urogenital system. Now, we will talk now about minimally invasive surgery in children. What is minimally invasive surgery? Minimally invasive surgery is a specialized form of surgery where instead of the traditional open operation where the surgeon makes a very large cut on the body to access the diseased part and do the surgical correction. That's the standard open surgery. If I have to do an operation on the lung, I have to make a large incision on the chest wall of the child. The ribs are retracted. I go into the chest and then operate and then come back and close all the wounds. If it's on the abdomen, I have to make a large incision on the abdomen. Now, what's the problem with open surgery? Open surgery has been the gold standard, but open surgery has its own problems. The main problems are severe pain after surgery for at least a week or two. Secondly, a large scar on the body of the child which is going to remain for life. Thirdly, a lot of morbidity associated with cutting a lot of muscle on the abdomen or the chest just because you want to access the organ of your interest, which is deep inside either the chest or the abdomen. You are cutting open a large portion of the abdomen or the chest just to access that small part. For example, the appendix, appendicectomy, common operation. The appendix is a very small part in the abdomen. But just to access the appendix in open surgery, you cut a lot of abdomen, cut a lot of muscles, just to do that small operation called appendicectomy. So, the minimally invasive surgery basically avoids these large cuts and the pain, the scar and the morbidity associated to the child and to the entire family is completely avoided by minimally invasive surgery. The problem with minimally invasive surgery in children, it's very popular in adults, but in children the problem is the small body cavities. Pediatric minimally invasive surgery requires a lot more expertise than doing minimally invasive surgery in adult patients. So at Ankura, we have some of the best experts in the country in pediatric minimally invasive surgery. So what are all the operations that we can do in pediatric minimally invasive? The minimally invasive surgery is commonly called as laparoscopic surgery or keyhole surgery or small incision surgery. So what do we do in this? In this, in adults 10, 12 millimeters and 5 millimeter holes are made, whereas in children we use 5 millimeter and 3 millimeter instruments. So very fine instruments are used in this operation, minimally invasive operations. So what we do is we make first one hole in the chest or the abdomen wherever we need to access the particular organ of interest, the disease, wherever the disease is there. We put a telescope through that and then we view the entire abdomen or the chest cavity about 10 times, 8 to 10 times magnification with a very powerful camera. So on the screen, we can view with large magnification, which is a great advantage of minimally invasive surgery because most of the organs in child are very small. When you view it under magnification, you can see better, so you can actually operate much better in minimally invasive surgery than sometimes even in open surgery. So the common operations we perform at Ankura, we perform the basic laparoscopic operations, medium level laparoscopic and very advanced laparoscopic operations also we perform in large numbers. So what are the basic laparoscopic operations? These are appendicectomies, repair of hernias in children, various hernias. Inguinal hernia is the most common, and then laparoscopy for undescended testicle, where the testis does not come down into the scrotum but remains in the abdomen. So we perform laparoscopy to check where the testis is. And then in the chest, we do operations like removing pus from the chest cavity, what we call as empyema. These are all basic and medium level laparoscopic surgeries. Apart from these, we perform almost every advanced laparoscopic procedure, laparoscopically. For example, in the urogenital system, we perform pyeloplasties even in 1 or 2 month old babies, including older children. Then we perform ureteric reimplantations for vesicoureteric reflux by minimally invasive laparoscopic or vesicoscopic techniques. We perform nephrectomy, which is removal of the diseased non-functioning kidney by laparoscopy. We perform a lot of other operations in urological procedures laparoscopically. We probably have some of the largest numbers in the country in laparoscopic pyeloplasty and laparoscopic ureteric reimplantation in children. In the abdomen, apart from appendicectomy, we perform anti-reflux procedures, fundoplications, excision of choledochal cyst, which is a major hepatobiliary surgery. We perform laparoscopically routinely in children. Then we perform operations on the pancreas laparoscopically. Then operations on the intestines like pull-through operations are also performed laparoscopically. In the chest, what we call as thoracoscopy, we are one of the few centers in the country performing thoracoscopic lobectomy. Some of the children, they are born with congenital problems of usually one lobe of the lung. The right lung has 3 lobes, the left lung has 2 lobes. Sometimes children are born with malformation of one of these lobes, what we call as CCAM and other problems. And here, sometimes the diseased lobe needs to be removed. Even this lobectomy, which is a very complex surgery, we routinely perform thoracoscopically without actually cutting open the chest, even in 6-month and 9-month-old babies. We are one of the few centers in the country performing these operations. So apart from this, we perform operations on the esophagus, operations on the diaphragm, what we call as diaphragmatic defects in children, diaphragmatic hernia, diaphragmatic eventuation. These diaphragm repairs in children for congenital problems are also performed by thoracoscopy by us in a routine manner. So basically, we perform almost all kinds of major operations in children by minimally invasive techniques, so that the child can have an excellent result without any major cut on the body, significantly reduced pain after surgery, early discharge from the hospital, and absolutely no scar on the body in the long term. Laparoscopic surgeries in children are very safe. Anesthesia itself in children is very safe, including newborn babies. We routinely perform major operations, sometimes in newborn babies, under general anesthesia for hours together, and it is quite safe. General anesthesia is quite safe, and the child, usually we don't expect any long-term effects of either surgery or anesthesia in children. So minimally invasive surgery, laparoscopic surgery, endoscopic surgery in children is very safe. And at Ankura, we are here to offer you the best services in this field, some of the best experience in the whole country. Thank you very much.